We have to make sure a vaccine is safe. We have to make sure it's effective. We won't do anything until we're certain of those facts. And we have to make sure that we have a sufficient supply, and as the supply grows, we're going to work on the priorities it will take to manage that supply properly. So first of all, the first phase when we have a sufficient supply will be to focus on those who need the vaccine the most. The frontline workers, the folks we depend on, healthcare workers, first responders, essential workers, the folks who are making this city run no matter what. And of course, the most vulnerable New Yorkers, the folks who are in greatest danger from this disease. That's the first phase. The second phase is the general public and making the vaccine available widely. And the good news, again, is we have a public health infrastructure in this city that is so battle tested, certainly in years before, having done huge vaccine efforts, but particularly in the last 7 months. Our public health apparatus in this city has learned such powerful lessons, has gone through such tough battles, but has done it so effectively. So we all wish we hadn't gone through this, but I'll tell you something, that everything that we've been through up to now has prepared us like never before to deal with the greatest challenges. And I tip my cap to everyone in our Department of Health and in health and hospitals, test and trace, all of the folks who have been part of this work, because they've walked through the fire and they've learned so much in the process. Now, of course, when we get to phase 2 and we're talking about widespread vaccination, we're going to use everything we have, our hospitals, our clinics, both health and hospitals and Department of Health clinics. We're going to use community centers, schools, you name it. And we're going to engage everyone in the healthcare world, public and private, including private physicians, pharmacies, urgent care centers, community vaccination efforts, whatever it takes. There's going to be a lot of information out, a lot of education, a lot of giving people the answers they need, listening to people, taking their questions, getting them answers from clinicians who can really help them understand, doing it in many languages, getting that information out through trusted community leaders. It's going to be a huge, huge effort, but we can make it work. And here to give you a sense of what we will do and what we learned from our own history in this city, our Health Commissioner, Dr. Dave Chokshi.
Thank you, Mr. Mayor. Imagine a virus arriving in New York City, and a Herculean effort is launched to vaccinate millions of New Yorkers in a matter of months, one of the largest campaigns in history. The health department organizes employees, medical providers, and volunteers, goes door to door in apartment buildings to educate community members, and partners with clinics across the city to handle lines of people waiting to be vaccinated. Well, this very event occurred decades ago in 1947 for smallpox in New York City. Turning to COVID-19 and the present, I do want to state at the outset, we are certainly not approaching the challenge of distributing a COVID vaccine in New York City with arrogance. This virus has humbled us before, but the New York City Health Department has a record, from smallpox to influenza, of mounting successful vaccination campaigns. We have the tools, the staff, and the experience at the ready to serve this mission, and a commitment matched to the magnitude of the challenge. Coordinating closely with our state and federal counterparts, we can leverage our well-established vaccine network to provide services across the city, at hospitals, community health centers, urgent care clinics, and pharmacies. In fact, we are already doing this, starting with our historic flu vaccination campaign this season. And with our new First Deputy Commissioner and Chief Equity Officer, Dr. Torian Easterling, we will ensure that equity is at the center of our response. Trusted local clinicians and community-based partners can address skepticism and help us navigate a history of healthcare provision that has too often failed Black and brown New Yorkers in particular. Trust is an essential ingredient for turning a vaccine into a vaccination. The models exist. For instance, we have employed community vaccinators during flu season. At a church in Greenpoint last week, a neighborhood identified as having low coverage, dozens of community members were vaccinated in a matter of hours. The governor has announced detailed plans, including ensuring that any vaccine distributed in New York is sufficiently vetted. And the state has outlined thoughtful questions to the federal government. We await those answers as well. In the meantime, we are activating our resources to prepare for an eventual first phase of distribution. This includes, first, closely tracking the science to understand when we will have a vaccine that is safe and effective. Second, enrolling and educating doctors and other clinicians. Third, adapting our databases to track orders and uptake. And fourth, developing detailed operational plans related to vaccine distribution, storage, and administration. In other words, we're marshaling the entirety of our public health infrastructure to meet this challenge. We have the expertise and we have the experience, but most of all, we have New Yorkers, communities and individuals who have pulled together so many times during this crisis. I know they're going to rise to this occasion in history just as they have for generations. Thank you.
Thank you so much, Dr. Chokshi. And I want to thank you. I think what our health commissioner said is reassuring, and it's encouraging, and it's true. That history, that really is something we all should feel proud of, and we should feel encouraged by. The fact is, New Yorkers, not just in this time, but generations before, have shown the amazing ability to handle any and all crises and to band together